Hi there, my name is Marie Powell, and I'm a nurse practitioner with the Bariatric Surgery Program at Eastern Health. The purpose of this webinar is to give you a more detailed view of bariatric surgery as you continue on with your journey. It will help to provide information about the bariatric surgery program with a view of allowing patients to make an informed decision about their choice to participate in the program, undergo surgery, and adopt lifestyle changes required both preoperatively and postoperatively. Some objectives for this webinar are to introduce the team and services provided, do a review of obesity, discuss criteria for bariatric surgery and assessment of surgical candidates, surgery overview, preoperative and postoperative care, benefits and complications of surgery, and a summary. So this is really a review of the first webinar. And if you haven't reviewed that yet, I really do encourage you to go through that webinar and write down any questions that you may have, as obesity is the basis for why you're all here. Obesity is a chronic and often progressive disease with risk of relapse and mediated by neurohormonal factors. Sounds quite confusing, but essentially obesity is chronic, meaning that it's something that will be with you lifelong, and you will need to work to manage this disease for the rest of your life. It's progressive, which means that over time, the disease gets more and more difficult to manage, even with surgery. It's relapsing, which means you may lose weight, but over time it comes back even with surgery. And it involves neuroendocrine factors, which is the biology of the human body. We know that there is dysfunction in the hormones that influence appetite control in the brain when obesity is present. And this is fully discussed in the first webinar. Let's do a quick overview of the treatments for obesity. The main one that we are going to focus on today is surgery, but there are others, which include medical and nutritional therapy, physical activity, psychology, and medication. We know that despite this webinar being fully based around surgery, there are medical and nutritional therapy, as well as physical activity and psychology, all discussed, as they all relate to people who undergo surgery for obesity. Bariatric surgery is not and cannot be the only treatment for obesity. It is not for everyone, and it is not a quick fix. It is certainly not an alternative to healthy eating and lifestyle change, and it does not lead to normal body weight in most cases. Obesity treatment requires long-term management and permanent lifestyle change. So let's talk about our program. The Provincial Bariatric Surgery Program is the only program in Newfoundland where we do bariatric surgery. It was established in 2011, and it consists of a team of right now 4 general surgeons, a full-time nurse practitioner, a full-time registered dietitian, and a part-time secretary or administrative support. The focus of the program is to select appropriate candidates for surgery through both assessment and referral criteria. The selection of candidates who are likely to have medical benefit from surgery can take priority, and there's a heavy emphasis on pre and postoperative teaching and follow-up. And this will likely rely heavily on support that already is in place, such as your family doctor, nurse practitioner, community dietitians, resources, etc. It's important to understand that our program is not a medical weight management program. Therefore, at this time, we are only seeing patients who meet all criteria for surgery. So what makes somebody a candidate for surgery? There are lots of factors that come into play when we discuss appropriateness for surgery. You do need to have a BMI or a body mass index of 35 with a comorbidity, which we have blood pressure, diabetes, etc. Or if you do not have a comorbidity, your BMI needs to fall within the 40 to 60 range. If your BMI is above 60, then you are not a surgical candidate and will not be seen by the bariatric team. There are certainly options to avail of for obesity management while you prepare for surgery, if that's the route you want to take. We currently only do patients who are age 18 to 65. They must be non-smokers. They need to be fit for surgery. And essentially what this means is that they have to be ready to put all of the dietary and lifestyle changes in play, if not already. They must have tried other modalities or methods to have lost weight through other efforts, which could be medications, different diets, nutritional plans, etc. They need to be medically fit and safe for surgery, which means that their chronic disease needs to be controlled or managed. They need to be psychologically stable, have reasonable expectations for surgery, and demonstrate compliance with food journaling, label reading, meeting protein, hydration, and calorie targets, eliminating caffeine, alcohol, etc. There are also factors that would make somebody not a candidate for bariatric surgery. These include drug or alcohol dependence or addiction within the last 2 years, or an active smoker, as discussed, untreated or inadequately treated psychiatric or mental illness. So essentially what this would mean is instability in your mental illness. Pregnant or breastfeeding, recent major illness such as terminal cancer, heart attack, end-stage organ disease, or somebody who's too sick to undergo surgery at the current time. Or if there are concerns about your compliance or knowledge base or understanding around nutrition and behavioral change. Once you are ready and have completed your journals with Andrea, our dietitian, you will then be booked in for your initial assessment. This is an assessment that is a nurse practitioner. As well, you will meet Andrea, our dietitian. This is a quite extensive evaluation of both of your medical history, your psychological behavioral history, their laboratory diagnostic tests that may be done, sometimes a physical assessment, a full nutritional or dietary assessment, and a psychosocial assessment. When you meet with myself, it could be through virtual means, through telehealth, Zoom, etc., or it could be in clinic, depending on where you live. We will do a full medical history and discuss your weight history, your medical and surgical history, your family history, medications that you take, etc. We'll also talk about your psychosocial status, which essentially in general, your lifestyle, your occupation, the amount of sleep you get, relationships, social support, substance use, etc. You will also have a full nutritional assessment completed by our dietitian. You will then undergo a full blood work panel with some nutritional blood work to get an idea of your baseline status, as well as some people may need to undergo other testing depending on their health. The physical assessment piece is generally quite minimal. However, this may involve an abdominal assessment or other types of assessments, depending on what is necessary. You will also undergo a psychological and behavioral assessment, which is quite general and completed by myself. And if needed, we'll go on to have a more in-depth assessment with a mental health expert. I do want to talk about the psychological assessment, as I do feel it is likely the most important part of this whole decision to have surgery. People who live with obesity are much more likely to suffer with diagnosed mental health illnesses such as depression, anxiety, personality disorders, etc. This does not exclude them from being a candidate for surgery, but instead it allows us to make sure things are quite stable in your life and that you are in a good place to undergo this big life-changing event. It is quite important for us to have the full picture of your overall mental health prior to having surgery so that we can ensure your success. Some of the things that we may talk about are your mental health history and diagnosis, any treatment you have had in your life, including medications, counseling, psychotherapy, etc., any hospitalizations you've had in your mental health in the past, any past trauma or events that have affected your mental health, any suicidal thoughts or self-harm that you've faced or endured in your life, a full history of any substance or alcohol use, life stressors, ways that you manage and cope with stress, and we'll discuss your overall social supports. We will also do an eating disorder assessment, and this is to ensure that there is no eating disorders that are prevalent prior to surgery that may cause you concerns after surgery. I will talk about the main three, but the most common eating disorder that we see in our preoperative patients is binge eating disorder. Binge eating disorder is a mental health illness, and it is characterized by the idea of eating unusually large amounts of food in a specific amount of time with a feeling of loss of control, meaning that you cannot control your food intake. It is then followed by feelings of shame, guilt, sadness, poor sleep, etc. Anorexia nervosa is a restriction of food intake, which leads to low body weight, intense fear of gaining weight, and disturbance in self-perception of weight or shape. And bulimia, which is quite similar to anorexia nervosa, is a similar type of fear of gaining weight and disturbance in self-perception of weight or shape. However, it is associated with a binge type eating with self-induced vomiting or purging, including the use of laxatives to rid the body of food and calories. These are the three most common eating disorders that we hear about. And we know that these can be quite problematic in people who are seeking bariatric surgery. Many people, while they may not have an active eating disorder, may have experienced some of these eating disorders, or many throughout their lifetime, and had treatment. This is something that's very important to discuss, as we want to ensure it's been fully managed and treated. We do not really know how surgery is going to impact your eating disorder after surgery if it's present, and therefore we need to ensure that supports are in place so that you are well, healthy, and don't become ill. All patients want to know how much weight they're going to lose. Bariatric surgery in the form of a laparoscopic sleeve gastrectomy, which is the most prevalent surgery we do, generally leads to about 25 to 30% of weight lost. This weight tends to come off quite quickly in the first 6 to 12 months, and then things do slow down and eventually will hit a plateau. At this time, if we look at an example, if you weigh 300 pounds and you undergo surgery, 25% of that weight will be about 75 pounds and 30% will be about 90 pounds. Therefore, this will be an estimate of about 75 to 90 pounds of weight loss through surgery. It is very, very rare to see patients lose more than 25 to 30% of their body weight. There's so many other factors that come into play, which we did talk about in the first webinar on obesity. It is important to ensure you have realistic expectations going into surgery so that you are not upset or sad by the amount of weight loss that you've seen. Any weight loss means success, and it means health improvement. Controlling our body weight is really not within our actual control. Weight is not a behavior. Many expect to lose way more weight than they will with surgery. And again, this leads to those feelings of disappointment. It is very important to focus your mind on goals outside of specific weight, such as coming off medications, increasing your activity, getting to do more things with your children, travel, hiking, etc. These are so much more valuable to a patient's well-being than the number on the scale. Another important thing to note is that surgery is not a diet. It is a lifelong commitment to changing your behavior to improve your overall health. So, as I say that, we do see the word bariatric diet here, which I really don't like, but instead this should say the bariatric surgery process. What happens is that you start at a specific weight indicated by this axis up here, and as time goes on, you go through various stages of weight loss. Immediately after surgery, as you're on a liquid diet, you do tend to see the weight come off fairly quickly. And eventually things are going to start to slow down, which we call long-term weight loss. And then the hard work comes in. That is where the lifelong maintenance stage comes in. This means maintaining all of the behaviors that you've put in place after surgery to maintain your weight. The slide down below explains this as well, but it also shows what happens when you stop treatment. Surgery is a treatment for obesity. The nutrition plan and the physical activity requirements that come with surgery are part of this treatment. And if these behaviors are not maintained after surgery, the disease comes back, which is obesity. So let's discuss why weight loss is not the goal. Weight loss is just a positive side effect of good health. It's not a behavior, as we discussed. Mindful eating, journaling, exercising, and making healthy, conscious choice are the behaviors. As a culture, we are quite obsessed with weight loss. As we know, it's discussed in commercials, magazines, movies, with friends everywhere. Whether it's just to lose those last 10 pounds, or if you have a more extreme goal to lose 100 pounds or more, people are constantly creating and setting up goals for themselves. When I work with people individually, one of the first things we talk about is their goals and their motivation. Many people have different goals, but I would bargain that most patients always discuss a number they would like to see on the scale. We need to ensure that these goals are realistic, and using that process, it's not really an ideal plan to say, my goal is to lose 100 pounds in 6 months. It is much more important to focus on the behaviors and the health changes that come with this. Do this boot camp, exercise 30 minutes per day, implement this meal plan, meet my targets. Those are the behaviors and the goals we need to set. Weight loss is then a positive side effect of health. When we set a goal to lose weight, you are setting yourself up for failure. Why? Because healthy lifestyle is not time bound. People look at the process like, I just need to do this and eat this way until I reach my goal weight, and then I can go back to what I was doing. Well, we know this does not work, and you've probably seen this multiple times throughout your life through different dieting means. The real work is in the maintenance. Focusing on the habits you need to achieve your goals are far more important than the goal itself. Once you reach that weight loss goal, things cannot stop. You need to keep doing the same thing and adhering to the same behaviors over and over to maintain weight loss. If you truly want to lose weight and maintain weight loss, the goal is the process. The actual goal of weight loss is not the number on the scale. It's the process of getting there. It's creating the habits that you can enjoy and maintain. If you can focus on changing your habits and creating ones that work for you within your specific lifestyle, then your goal of weight loss will come much easier and the process becomes much more enjoyable. Once you meet with the bariatric team, you're then going to go on to see one of the bariatric surgeons for a quick assessment. They will see you in clinic in St. John's and will sign your consent for surgery. This will only take place after you are considered an appropriate candidate by the bariatric team. Surgical wait times vary and can depend on the number of referrals and operational abilities of the team. This fluctuates quite frequently. You will be given as much notice as possible to prepare for your surgery date. So let's go talk about the surgery itself. The most common procedure that we do within our provincial program is laparoscopic sleeve gastrectomy. Some people will hear this as gastric sleeve, vertical sleeve. Essentially what occurs is 80% of the left side of the stomach, which is the stretchiest, largest portion, is fully removed. You are left with a banana-shaped pouch, as seen here, which is quite small in comparison to your stomach prior to surgery. This leads to a restriction of food that you can consume and also causes hormonal changes. Ghrelin, as discussed in the first webinar, is a hormone that makes you feel hungry. Most is secreted in the lining of your stomach that is removed. Therefore, many people do not feel true hunger after surgery. It's a slightly easier, more simple procedure than the gastric bypass and takes quite a little bit of shorter time, about an hour total in the operating room. And your stomach capacity at the end is about less than 1 cup, which is quite small compared to your previous stomach size. You will have 3 or 4, sometimes 5 incisions in your abdomen, and you will not have a full open incision. The surgeons will use their tools then to remove that portion of your stomach and take it out of your body completely. You will then be brought to recovery for an hour or so and then brought up to the floor to stay for 1 night. Gastric bypass is a similar yet slightly different type of procedure. It is restrictive in that it reduces the amount of food you can take, but it also leads to a rerouting of your intestine, and therefore your whole stomach gets bypassed. This means that your body may not absorb certain nutrients or medications the same. There are some hormonal changes as well, which we discussed, including removal of ghrelin and others. It technically takes a little bit longer to do than the gastric sleeve. There are many times that food intolerances are slightly more common with this type of procedure, and it does require a little closer follow-up because you can be at higher risk for nutritional deficiencies after surgery. So what are the benefits of these types of surgeries? They certainly lead to an improvement or complete resolution of type 2 diabetes. At 2 years post-op from lap sleeve gastrectomy or Roux-en-Y gastric bypass, approximately 72% go into full remission and not requiring any diabetes medication that they may have been on prior to surgery. We see about a 50 to 65% improvement or complete control of hypertension or high blood pressure, cholesterol lowers, improvement in sleep apnea, about 71%, improvement in mobility, increased quality of life, decreased pain, improved mobility, which we already discussed, and an improvement in being able to do those ADLs, which are our activities of daily living, washing, sleeping, going to the store, going to the mall, shopping, paying bills, tends to all be a little easier. We also see increased fertility and an overall increase in life expectancy. As with anything, there are some risks. Some early surgical risks are a leak along the surgical staple line internally, bleeding, infection, internal organ injury, conversion to open procedure, which means the surgeons have to completely open you up to complete things, a blood clot in your lung, leg, or other, and a heart attack, stroke, and certainly death. However, these are very, very, very uncommon, and most of these risks are about less than 2% to less than 0.5%. Later surgical risks that we see could include a stricture, or what we call a narrowing in the esophagus, or an obstruction, where people cannot tolerate food or fluid after surgery due to that tight space. Gallstones, which happens due to rapid weight loss. Incisional hernia, which is due to a defect or weakening in the muscle wall around the belly or the incision. Nutritional deficiencies, the most common being vitamin D, iron, vitamin B12, etc. And weight regain, which we already slightly discussed, but certainly it is a risk of surgery if the disease is not managed lifelong. Pre- and post-operative process. Once you get your surgery date, you will be instructed to do a full fluid diet for 2 weeks prior to the surgery date. Some patients will have to do more and some will have to do less. It is certainly individually based. However, the approximate timeline is 2 weeks. You will attend the pre-admission clinic at the Health Sciences Center the week before surgery. You will come back on Monday for your surgery or the day of surgery. Once you are brought into the OR and put to sleep with general anesthetic, it takes about 1 hour to complete the full surgery, and gastric bypass about 2.5 to 3 hours. To prevent blood clots, you will have some compression stockings, you will be given blood thinners, and the nurses will get you up and moving as soon as possible. Close monitoring of vital signs such as blood pressure, pulse, etc., and blood work, and you will go home the following day if you are feeling well. One of the risks of surgery is nutritional deficiency. And while this is more common with gastric bypass, it is certainly also quite common in gastric sleeve. After surgery, you will need a complete multivitamin and mineral supplement, and you will have to take 2 a day. You do not want to choose a gummy, as they do not contain all that we need you to have, including minerals. We do not want you to choose a 50 plus or senior adult multivitamin unless discussed with us. We also recommend for all patients after surgery, calcium citrate, vitamin D, vitamin B12, and sometimes others based on your blood work. We do keep a very close eye to your blood work and ensure that we are giving you the right vitamin and mineral regime to stay healthy and nourished. And then there are some common issues that people feel after surgery, which are not necessarily complications, but more so we see happen right after surgery or as time goes on with weight loss. Gastric sleeve can cause worsening reflux or heartburn. It can cause some nausea at the beginning as well as vomiting. Some people, if they are nauseous and have a lot of reflux, they do not or cannot get in the right amount of fluids, and therefore they may become dehydrated. Constipation is also very common after surgery because of the anesthetic, painkillers, and being on a liquid diet in the postoperative time period. Gallstones, as discussed with weight loss, fatigue due to low calorie intake. Hair loss is a very common experience that people have during rapid weight loss, and this generally occurs about 3 months out from surgery. It is a temporary phenomena, and it does go away once your weight loss stabilizes. Feeling cold and excess skin, which is certainly quite common after rapid excessive weight loss. In terms of follow-up, myself and the dietitian will see you on the day after surgery prior to going home. You will also see us then in clinic or virtually at 1 month post-op, 3 months, 6 months, and 12 months. At your 3, 6, and 12-month visit, you will have blood work done. These visits are essentially a general discussion of how things are going, your medical, nutritional, psychological well-being, blood work, medication review, any ongoing symptoms or concerns or complications, and any ongoing care that's needed. What does life look like after bariatric surgery? We certainly call the first 0 to 12 months the honeymoon phase. From 0 to 1 month, you're on a full food diet, and then you transition into your soft food diet and then a solid diet. This will be discussed in full in the nutrition webinar. You have a significant calorie restriction from your baseline or what you were eating preoperatively. You experience rapid and quick weight loss, many changes, both physically, metabolically, and emotionally, and your body is in a state of constant adaptation to the weight loss. At 1 year to 2 years out, the work is hard. It is all about the maintenance. It's becoming comfortable with what you can and can't tolerate and the restriction that you have. People do get frustrated when they see the scale not move and they start to see their weight loss plateau. It's about ongoing compliance with all of the behaviors that were set up and put in place prior to surgery. 2 years out, it becomes a permanent lifestyle change. But certainly, some people do find they go back to older habits or have certain life events that lead them to gain weight or have some struggles. There are many positive changes: improved health, increased activity and energy, decreased joint pain, increase in self-confidence and esteem, improved sexual function and intimacy with relationships, and overall improved quality of life. We can't discuss the positives without discussing the negative or potential negative experiences people have. As mentioned, we all have an idea of what our body looks like prior to surgery. When you lose a very excessive amount of about 25 to 30% of your body weight, people do end up with a lot of loose excess skin, which causes them a lot of psychological distress at times. They simply do not like the way their body looks. They feel dissatisfied with their weight loss. They feel like they actually like their body prior to surgery even better, which is a common comment that I hear. Plastic surgery is certainly an option and the most successful option for excess skin. However, it is very expensive and is rarely covered by our provincial MCP plan. The plastic surgeons certainly have strict requirements for who has surgery and who makes great candidates for surgery, and this is a discussion you can have with them as time allows. Ideally, plastic surgery is not an option until you are about 2 years out from surgery. Some people experience a mind-body lag, and this is essentially your brain is not catching up with the rapid changes in your body. Some people still feel that they weigh exactly what they did prior to surgery, despite quite excessive weight loss. They may still shop for the same size clothes, even though they need clothes that's 3 or 4 sizes smaller. They may look in the mirror and not see change. That can be very hard for people. And eventually, we hope with time, your mind catches up to your body and you start to see your successes. There can also be changes in the relationships in your life with your partner, spouse, children, extended family, colleagues, and friends. Some people experience unwanted attention. They feel like they're not invisible anymore. They get comments about them taking the easy way out, or they're crazy for having surgery for weight loss. Sometimes there's jealousy involved. Divorce and separation rates surprisingly are quite high after bariatric surgery. There's lots of research being done on these changes, but they can lead to negative relationships. Many people feel very disinhibited and don't want to tell people that they've had surgery for fear of what people will say. Also, in the family home, they may feel pressures around food, or when they're out with friends, they may feel pressure to eat certain things, even though they know they cannot or cannot tolerate it. These are very challenging things that people experience, and there's certainly help as needed. It is important to remember that while bariatric surgery and weight loss can lead to some improvements in your mental health, it is not the cure for mental illness. Some people find their mental health gets worse after surgery. There is no general rule, and it is impossible to predict if your mental health will or will not improve. Long-term treatment and management of your mental health and all of these psychosocial challenges that we discussed is critical to your success. Support systems are very important, and this is why we discuss these prior to surgery. Having people who understand you and the reasons behind surgery and your weight loss can be critical to your overall well-being. This can include family, friends, coworkers, online or local support groups, along with others. Having a good, solid support system after surgery can lead to faster recovery, improved weight loss and outcomes, and less mental health challenges. There's also professional support. Family doctors, the bariatric team itself, community health or dietitians in the community, social workers, psychologists, counselors, support groups, or psychiatry if as needed. And we can certainly refer you on or connect you with the right resources. I always like to talk about weight regain. Everybody has a fear of weight regain. When they undergo significant treatment for obesity, such as surgery, it is important to think about the long-term effects. We know that surgery is not the cure for obesity, and it is quite possible to regain weight as time goes on. As we get older, it is physiologically normal to regain a small amount of weight over time. Common reasons for weight regain after surgery include physical problems, such as enlargement or stretching of the sleeve, medications that may cause more weight gain, certain diagnoses or medical conditions, such as hormonal disease, hypothyroid, pregnancy, menopause. Being able to eat larger amounts of food as time goes on and the restriction lessens, consuming really high calorie foods that are easily tolerated or high calorie liquids, eating small amounts of food constantly throughout the day, or a behavior we call grazing, returning to old eating behaviors and habits, not food journaling, which therefore makes you unaware of your intake and how much you're actually getting in, mindless eating, and not coming to your follow-up appointments and committing to lifestyle change long-term. Many patients ask about having surgery for weight regain. It is possible that gastric bypass is something people hear of, which will help with more weight loss after they've had gastric sleeve. Gastric bypass is certainly another big surgery and can be performed after a gastric sleeve for many reasons. You may hear this referred to as revision surgery or secondary surgery. The main reason people have these surgeries are to cure chronic or severe reflux that can happen after a sleeve gastrectomy. In some provinces, patients will have revision surgery just to manage weight gain. However, this is not an option for everyone. The underlying reasons for weight gain need to be addressed before another surgery will be considered. These are some questions for you to reflect on as you get ready to undergo surgery and move on with the process. Why do you want to have bariatric surgery? What do you look forward to most? Are you committed to changing your lifestyle permanently for health and long-term success? What are your goals for after surgery? It is important to think about these things as you go through this process. Journal and write down any thoughts or ideas you may have. We can certainly discuss all of these when we see you. This is our contact information as needed for any questions or concerns. So let's summarize. Surgery is only a tool, it's not a cure. Laparoscopic sleeve gastrectomy, along with other bariatric surgeries, are permanent. Diet and lifestyle change is critical to weight loss maintenance after surgery. This continues lifelong. Follow-up and adherence to recommendations from us increases your ability to be successful. And behavior change starts now. Practice, practice, practice. Thank you so much for listening to this webinar, and we look forward to working with you.